I'm Leah Giarratano. I'm the author and presenter of a 2-day training program on treating post-traumatic stress disorder. This is a brief overview of this training program. I've been a clinical psychologist since 1995, and I've been training clinicians across Australia and in New Zealand in how to treat traumatic stress disorders. I was also a foundation team member of an award-winning inpatient PTSD program. I'm the author of 7 psychological texts and also 7 novels. If you're interested in my background or in more information about this training program and another 2-day training program that I offer on treating complex PTSD, please see talamanbooks.com. Just a little bit of an overview of the Treating PTSD program. There's an introduction to PTSD, some information on comorbidity, other conditions that go along with it, and a little bit about the epidemiology. Who gets it? Do we know any risk factors and any resilience factors? So we all get on the same page with some of that background information, and then we get into highly practical, evidence-based techniques for actually treating this condition. We start with treatment maps and planning strategies and psychoeducation to get some control over all the information that clients come in with. And then the rest of the program is case-based, and you learn tools to treat PTSD, including prolonged exposure therapy for processing traumatic memories and for challenging irrational cognitions that are tied into those traumatic memories. This training program is available live streamed, so you can sign up to one of those live stream programs if you want to, available online, but questions are able to be asked via live stream. It's also available in a 3-month online training package where there are lectures, quizzes, case studies and exercises. And it's also available in live face-to-face workshops across Australia and in New Zealand. This is one of the education modules that we offer in the training program. It's called the TRAP model, and it will give you a bit of an idea of the structure of the program as well. So if your client goes through a traumatic event and ends up with PTSD, you can say that they're stuck in a bit of a trap and you have some strategies to help get them out of the trap. The T stands for trauma, which goes along with criterion A in DSM. The R, re-experiencing, criterion B. The A is for avoidance, goes along with criterion C and D in DSM-5. And P is for physical tension, physical arousal, goes along with criterion E. We begin with a crisis management tool, a basic functional analysis that can help you make sense of problem behaviors that often propel your client into therapy. So things like substance abuse, overworking, gambling, self-harm, anger outbursts. These are often ways the client is trying to block the traumatic memories from their mind. We then look at a range of different psychoeducation tools, the TRAP model being one of them, and there are others. We also look at arousal reduction strategies that are quickly implemented to reduce the hyperarousal symptoms in the P column here, and some practical strategies for anger management, realizing as well that anger is often locked into traumatic memories, and we look at trauma processing in the R column of this model. We then move into best practice treatment for fears and phobias using in vivo exposure therapy to help tackle avoidance behaviors that clients have developed since they were traumatized. And once we have that form of exposure therapy under our belt, we move into the R column, tackling the symptoms our clients hate the most, the re-experiencing symptoms. And we learn prolonged exposure therapy from start to finish to process traumatic memories with our clients. And snapped onto that is cognitive restructuring in relation to the self and the traumatic event. These are negative thoughts the client has about the trauma itself, which are much harder to challenge than outside world cognitions. But when you do it in combination with a trauma memory processing technique, it's much easier to help the client to analyze and come to terms with irrational thoughts about themselves in relation to the event. That's a brief overview of treating PTSD. There's also a brief video on the 1 to 4 package, days 1 to 4, and a brief video on days 3 to 4. Thanks for your attention. I look forward to seeing you at one of the workshops.